Hey, it's Dr. Shah, Denver board certified plastic surgeon. I do specialize in aging face surgery. Now, on social media, if you've been paying attention to trends in plastic surgery, one of the things a lot of people are talking about, especially with these gorgeous before and afters of people like Lindsay Lohan, Demi Moore, etc., they're starting to talk about this idea of doing more comprehensive facial surgery rejuvenation to get actually a more natural, more elegant, and just better looking outcome. Most patients will try to do a lot of their facial anti-aging surgeries in piecemeal format, which is perfectly fine, to each their own. But we as surgeons have been trying to teach patients for many years about the idea of doing everything that you can at one time so that you're getting a more global improvement and you're actually able to show your kind of holistic improvement to yourself in the mirror and obviously to the world. So here's a little case that I want you to know. This is a patient I've had for many, many years. So this picture right here is back in 2008. At that time, she'd not had any plastic surgery. She'd been doing some skincare. So 2008, get it? She's 57 years old in this picture. And so at that time, I did lower eyelid surgery. I did a lower face and neck lift. At that time, I used a SMAS plication technique. I've done thousands of SMAS plication facelifts. It's a nice operation, very safe. I've moved on from that technique now, and I'll discuss that in a minute. But here, you see what she looks like. So here she is 1 month later. She's got a little bit of swelling in her neck, but you can see her lower lids look beautiful. Her face is lifted. Her neck is much smoother. The bands are repaired. And that's fantastic. Now, the cool thing about this patient is this is what you get when you consider a more holistic change. She really didn't need upper eyelid surgery and wasn't bothered by it. Her brow position was excellent, so I didn't really need to do sort of what we would call quote-unquote upper face surgery. I did the lower lids. Her mid-face was gorgeous, and when I lifted the cheek mask, I filled it in. So you didn't have to do facial mid-face augmentation either. So for her at this point in time, a more holistic augmentation was a lower face and neck lift, and it was lower eyelid surgery. Now, here she is. She's now 74 years old. Between this time and this time, I've gone on to perform endoscopic brow lifting surgery. I performed a second deep plane facelift operation on her, and I performed another neck lift and recently a lip lift. So now she's 57 years old here. She's 74 years old here, and she's now 8 months post-op from her third neck lift and a subnasal lip lift. Her scar is invisible, she looks beautiful, and there is a whole face sense of balance and rejuvenation. Now, the cool thing about this patient is she's very bright. She is very on top of her skincare. She has done skincare for years since when I first met her to now. She does skin work, she does microneedling, she does toxins, she does laser resurfacing with me. She understood the assignment, let's say. So I want you to understand that when you think about your facial aging, obviously do what you can afford, but the right answer is do as much as you can afford and maybe push it a little because you will end up looking better. And I say this to every single one of my patients when they come into consultation. Once you do your first facelift or your first facial rejuvenation surgery, you will forever look better. So I hope you understand why when your surgeon tells you, I think you should do your temporal brow lift, your upper lids, your lower lids. They're trying to give you the most holistic, best outcome possible so that you always look your best. So thanks for watching.